Susan, my clock says 6 o'clock. What about yours?
That's what mine says.
Okay.
Straight up and down.
Straight up and down, 6 o'clock. All right. All right. We'll go ahead and call this meeting to order.
You have feedback there, Mr. Chairman.
Feedback?
It's better now. Okay.
Okay. I guess we'll go ahead and call the meeting to order. I guess our first item this evening is our prayer, which will be led by Commissioner Williams. Commissioner Williams?
Thank you. Father God, as county officials, we come to you humbly seeking guidance on the eve of the National Day of Prayer, that as a nation, state, and county, we can seek your grace even more during this pandemic and division in our country. Please heal us physically, mentally, and spiritually. Remind us as we pause for prayer tomorrow at noon that you, Lord, are our constant guide and protector. Thank you for your help, and we pray in Christ's name. Amen.
Amen. Thank you, Commissioner Williams. All right, our next item is the determine the essential function of the governing body requiring a meeting to consider these items. Allison, is there anything you'd like to add?
No, sir. If you'd just like to look at your agendas, you'll see that this, what it's related to COVID-19 and an update be related to those topics.
All right. Thank you. Do we have a motion to declare these essential items to consider this evening?
I make the motion.
Mr. Chairman, we need to do a roll call, don't we?
We do.
Do you need a second on that essential business motion?
Yes. Commissioner Light made the motion
I'll
to
second.
approve the agenda, seconded by Commissioner Jones. Madam Clerk, will you call the roll, please?
White.
Here.
Harris. Fitzgerald. Edens.
Here.
Davenport. Matherly.
Here.
England.
Here.
Malone.
Here.
Williams.
Here.
Carriger. Jones.
Here.
Hester.
Here.
Callister.
Here.
Wheeler. Ford. 10 present, 5 absent.
Thank you. We do have a quorum. Now, we will go back and to consider Commissioner Light's motion to approve the essential agenda. Commissioner Jones seconded that. Is there any discussion or questions about the agenda? Seeing none, Madam Clerk, would you call the roll to approve the essential agenda?
White.
Yes.
Fitzgerald.
Yes.
Edens.
Yes.
Matherly.
Yes.
England.
Yes.
Malone.
Yes.
Williams.
Yes.
Jones.
Yes.
Tester.
Yes.
Callister.
Yes.
10 yes, 5 absent.
Thank you. The essential agenda is approved. Our first item on that agenda is remarks and comments from Mayor Grandy. Mayor?
Thank you, Mr. Chairman. We have a couple of guests tonight who can speak to us about an update on our, health condition in the county and the region and what's going on. And before they start, and I forget to do this later, I just want to thank Kristen and Dr. Kursky and Eric Deaton from Ballot. They have given up their time to come update us on a regular basis, and I just want to tell you how much we appreciate it. So I guess with that, Kristen, would you like to start or lead the health group?
Sure. We still continue testing at the health department Monday through Friday from 9 to 3. We will be keeping our National Guard team at Washington County. They will also be staying for Greene County Health Department to continue testing there as well. This testing will continue indefinitely at this point in time. Not really sure when we will end that. Today we tested 70 people, so our numbers range between 50 and 100 people every day that we test. We did receive a shipment of the masks that Governor Lee was mentioning in his remarks earlier this week. Actually have 7,200 of those at the health department in Washington County. These masks are for anybody that would like to come and get them. We're asking people if they have loved ones or those who might be not able to get out of their homes right now to take a mask and share as well. So these are free of charge, provided by, I think it was a company out of Cleveland, Tennessee, who was working on those to prepare those for us. So if you know of a group or some people who are interested in having some of those, you can reach out to me or just come by the health department at any time at the second floor entrance. So it's at the back of the health department up in that upper parking lot. Don't really have anything else to report from a local health standpoint right now. I'm sure Dr. Kursky might have some information that he would want to share.
Dr. Kursky, thank you for being here.
Okay, sorry. I tried to share my screen. Is everyone seeing the graph there?
Yes, sir.
So we have had somewhat of a decrease in cases lately, especially compared to the first, several weeks ago. But we still are seeing cases daily for the most part. I think we had 4 new cases today. Two are Washington County. I don't know if they're city or county. I believe 2 are Washington County. Including 1 nursing home or assisted living resident in the county today that we learned about. So we are continuing to get cases. We are working to test nursing homes. So we have offered testing for all nursing homes and assisted living facilities that want to do so. The governor's encouraging. So we find out about more positives from nursing homes as we go along. So what else? This is the face mask that we've been given. So apparently it's made by a sock company, so it's black athletic sock material. And we have a lot of them. So if people want them, so it's not medical grade or anything like that. But if people don't have a cloth face mask, they can come to the health department to get one if they need one.
Great, thanks. Anything else, Dr. Kursky, on cases or anything, or where we going?
We do continue to get asymptomatic cases. So, yeah, really just trying to remind people that as they start going back to some of these businesses that are opening, restaurants and businesses, especially the personal touch businesses, just to be careful. And, I think we do want to encourage people to steer towards the ones that seem like they're taking all the recommendations seriously, which I know that you all are in an effort to try to help people figure that out.
Great, thanks. Eric, how's Ballard doing?
Thank you, Mr. Mayor. Appreciate being with you all tonight. We're doing very well. I'll tell you, we have 11 patients in-house that are being cared for that had COVID-19. We have 7 that are what we call PUIs, or patients under investigation, that we're ruling out. They've been tested today, and so we'll determine if they have COVID or not. We have 245 ventilators available to care for our patients, and about 320 or so beds that have been designated as COVID dependent beds, or designated beds that are available to our community. So we're in very good shape that way from a resource standpoint. I think we're in very good condition right now with our PPE. My hat's off to our supply chain. They've done a great job at obtaining enough PPE, and we feel good about that. And at the same time, we've stood up surgery. We had surgery for the second day, more of those type of elective or scheduled surgeries versus the emergent surgeries. We were doing before, we were doing about 100 cases a day, which is very, very low for us across the system. We're doing about 250 cases a day now of surgery cases. That's about 50 to 60% of volume. We'll see that increase next week as we start adding cases that are more acute, and those patients that will stay in the hospital a little longer. We're being very careful about our PPE. We're being very careful. We're testing every single patient prior to surgery. And so to help determine if they were to have COVID, as Dr. Kursky said, not all patients that have COVID-19 are symptomatic. So we're trying to make sure to protect the patient and their family and our caregivers that we know if there's a COVID-19 patient that we're performing surgery on beforehand. And that's working well. We're utilizing our test sites to make that happen. We had a news conference today, press conference today, as we do a couple of times or once a week now. And we talked about testing. Our testing has expanded. We've done a little over 7,000 tests now since we started testing in early March. And so I think our drive-up testing is working well. Most tests, if they're either same day or within, we send those tests out within 48 hours. And we're testing people now regardless of whether they are symptomatic or not. We are asking them about their symptoms because we're working on a prevalence study with ETSU to determine, and our Institutional Review Board, IRB, to determine what the prevalence is within our region. So I think we're going to have a sample of probably 800 or so is what we're looking for to have a good sample. So we are working on a prevalence study to understand what that looks like within the region. We're only seeing maybe 1 to 2 per day right now as far as positives go. And so I think that's, as Dr. Kursky said, that's starting to flatten out from what we're seeing now. Like I said, the non-emergent surgeries have begun, and we'll continue to ramp that up over the next few weeks until we're at full capacity. We have been pulling team members back from furlough to help support that, so that's good news, putting people back to work again. And so that will continue to ramp up as we get busier. So our surgeons are anxious to get back to work, and our patients who want to have surgery are anxious to have that done, who've been putting it off. From what I can tell, all of the patients we have talked to feel good about coming back to the hospital for surgery. There does not seem to be apprehension about that. We're taking a lot of precautions. Everyone that enters our facility now has to have a mask regardless of whether they're visiting or not. We're keeping our visitation restrictions very tight. We are making sure that all of our team members and everyone that walks in gets tested through gets their fever or get their temperature taken and going through screenings just like we always have. And we'll continue to do that going forward. We're not loosening our visitation restrictions. We're keeping those in place. We have loosened travel a little bit for our team members on a personal basis because our feeling has been that it's become fairly widespread across the U.S., and so we are allowing people to travel outside our region for personal or vacations. But anyone in any of our buildings, regardless of whether they're in a patient care environment or an office setting, has to wear a mask if they're not inside their own office. And so, or if they're in a meeting with other people, they have to wear a mask at all times. So that's, we're trying to take a lot of precautions around that. We also announced today at our press conference, we've developed a business toolkit that is information taken from the CDC. We've emailed a link to that, or that information to about 300 businesses today, and it's on our website. It just gives guidance to businesses as they start standing up their businesses again, and how to do that safely. And then we also have sent it to the Chambers of Commerce regionally so that they can provide it to businesses, some help with setting up their business again. One great need that we have still right now is blood donations. We're starting to see people being afraid to go give blood because I guess they're worried about that. But we're taking a lot of precautions around it. It's a very safe procedure to give blood. And so that's something that we really need. What's also happened is we can't utilize our blood mobiles because of the number of people that attend those. We're trying to social distance. So all the blood donations need to be done through an appointment process. And so we do need blood to be given. So we're going to continue to ask for that from the community. Last couple of things that are really good things I'll mention to you. One is today is National Nurses Day. So you can virtually hug a nurse if you want to, and that you know about. And our nurses are just amazing. And I'm just so thankful and grateful for the work that they do every day. I told the group earlier, I've been in healthcare over 35 years, and you know, my chief nursing officer is a person and is my go-to person for something if I need to know what's the right thing to do in taking care of a patient. Our CNOs across our system are fantastic, and so I'm so thankful for the work that they do. And then the last thing is we've discharged 3 team members from our hospitals recently who had COVID-19, and all 3 are doing really well. All 3 were on ventilators at one time, and all 3 were probably in the hospital for almost 3 weeks. And so Dr. Daniel Lewis, who I think has been on, as you may have seen his name on Facebook some, went home Saturday, and he's doing very well. I actually texted with him today and doing very well. And we had a young lady that left Holston Valley yesterday who was in her 20s, and she's doing very well, went home. So we're very thankful for that, and our prayers continue to be with them as they recover. Mr. Mayor, that's all I have for right now. If there's any questions, maybe.
Eric, thank you. Appreciate it. Questions for any of the healthcare group?
I want to ask Eric a question.
Yes, ma'am.
Eric, if you have a COVID patient that looks like they're not going to make it, are you letting any family member be with them?
Yes, ma'am. We're, because we've tightened restrictions on visitation, we've been very clear that that does not apply to someone who is at end of life or in hospice care. We've done a couple of things. We provided virtual visits where they utilize iPads and things like that. But we also give the family members personal protection equipment, the gowns, the masks, all that, so that they can actually go into the unit and see their family member. We think it's a very safe practice. It's one that we have done since the beginning, and we feel very strongly that if someone is at end of life, that we allow their family to be with them during that time.
Well, I hope so. That's a very good practice.
It's very important, and we just have to, take a few extra steps to make sure everyone's safe. That we're committed to doing that.
Good.
Hey, Mayor, I just wanted to add that we are working with ETSU and also with Valid on kind of collecting data that we'll need to monitor, over the next weeks or months to determine how it is going with the outbreak locally, to know, just for situational awareness for hospitals and government, to know if we need to increase messaging to the public, or at some point potentially need to kind of put more restrictions on social gatherings or whatever. So we are working with ETSU and with Ballot on getting kind of a data dashboard, which ETSU already has a pretty good data dashboard. But we're trying to see if there's additional things that need to be added.
Thank you, sir. Other questions for any of the health folks?
Dr. Gursky, when the governor talked this week about all the nursing home testing that he was wanting to do, can we expect to be seeing that pretty soon in our numbers, or are you already doing that? Or I'd just like to know where we were.
Yeah, we're actually the first region to have done it. So basically the day after, we sent out 500 kits or so to several nursing homes. It was mostly the nursing homes I think we talked about that had questionable results the week before. So we're currently in the process of retesting and have retested most of all of those nursing homes that had positive results that we think might have been false positive. But one of them did have another positive, so it looks like potentially, and we had talked about we couldn't say for sure they were false positives, so everybody was being treated as if they were positive. And we have found at one of those nursing homes a positive through the lab that we use at the state health department.
And I would add that we're also working with the health department and with nursing homes to test them if they're leaving the hospital to go back to a nursing home. We're testing them prior to that to make sure that they're not carrying that back, carrying COVID back to the nursing home.
Yeah, the nursing home all requested that. Yeah. Yeah, so I will say any nursing home that wants testing, they just need to contact the health department and we'll put them on the list so we'll know how many supplies to order for them. We're primarily having the nursing homes do their own testing, but we're supplying the test kits and we're doing the actual tests. We don't want to introduce our people into nursing homes that are restricting visitors and potentially bring in coronavirus.
Okay. Commissioner Wheeler?
Question for Eric. Eric, while you were talking, I was listening and going through the Ballot site to try to find that information you're talking about for businesses. And I wasn't able to locate that, but is that something that we could get a link to put on the county website, maybe the city and towns, to help some other businesses get to that?
Absolutely. And I probably misspoke. It'll be out there by tomorrow. So, but what I'll do is I'll send a link to Mayor Grandy and make sure it gets out to all of you. So I'm happy to do that tonight. So.
Thank you.
Yes, sir.
Okay, other questions?
Excuse me.
Go ahead.
Is there any indication of when larger groups can begin to assemble?
Yeah, I think that primarily depends on how it goes over the first few weeks when we, now that a lot of different businesses are reopening, we'll have to kind of see what the numbers look like. We don't really get any indication from the governor ahead of time, so we may all just hear at the same time on the governor's press conference.
All right, thank you.
Okay, we also have Rusty Sells with us today, our EMA director. Rusty, do you have anything you'd like to add, or does anybody have any questions for him?
Just starting to go through the application process for the reimbursement on the COVID pandemic that we're dealing with. We're also going through, we have another declaration for the April 13th floods. So I'm working two different declarations at the same time. We should see that application be approved probably within the next week. Coming back from FEMA, and we'll start being able to submit some of the costs that we've incurred for reimbursement. No idea on the time frame on getting the reimbursement back. This is a little bit different than a normal disaster because the entire United States is involved. So getting the money back and the refunds or the reimbursements back could take a little bit longer than what we've experienced in the past on natural disasters. So that's the only update that I have for tonight.
One of the good things, one of the things that puts us in a good place, I think, is that Rusty's experience in what he is doing led us to be able to capture these costs really from day one almost. And his guidance and leadership has given us a good source of data. So as we begin to fill out these applications and stuff for reimbursement, we don't have to go back and try to figure it out. We have it all. We should be able to get it assembled fairly quickly. Hopefully, if we're at the front of the line, we'll get it a little faster. So, questions for Rusty or any of the others?
One thing, if you have anybody that you know that has made homemade masks or has volunteered hours toward this COVID pandemic, if you could have them contact my office, we can capture those hours. I have several from some ETSU students and some ladies that have been making the homemade masks. We can actually put a monetary value with that person's hours that they've worked and a monetary value on the mask that they donated, and that will help offset the 25% match that we will have when this reimbursement comes back. FEMA is only going to reimburse 75% of the cost that we spent. So we will have a 25% match there. So any hours that we can capture from volunteers and how many masks they've made and turn in and things like that, we can capture all of that and hopefully have a zero balance on that 25% match. So.
Well, let me ask you a question regarding that. Do they
Yes,
have
ma'am.
to have, I have women in my church that have made masks, but do they have to relinquish them to some source, or can they keep them within whoever they've made them for originally?
No, they can, as long as they've made the mask and they've taken their time, if they can, I have a time that I can send that they can actually log their time. And
okay.
If they'll just tell me how many masks they make, as an online source, we found that most of the masks that you can buy are somewhere between $12 and $18. So we use $16 a piece for those masks. And the time, I think the hours that we put on that, or the pay per hour, wasn't it $15 per hour there, Mayor?
Yes, sir.
So every hour that they spend making those, we can count. So somebody that you know, or I can get it to the church, I can get a time sheet, and all they have to do is go back, and if they can just estimate the times that they've worked and the hours that they put in, we can capture all that.
We need to know the number of masks that they have produced. Is that helpful also?
The number of masks, yeah, because we're putting that $16 per mask on there. So.
Very good. Okay. Maybe you could put a link to your form somewhere on the county website, and they can pull it up and fill it in. Would that work?
I can do that. I actually have an emergency management section to the county website, so I can put it on my website.
Very good. I'll pass it on. Maybe
Okay.
other churches or other sources, I should say, could also find it.
Yes, ma'am.
Very good.
Okay. There's no more questions for right now. I would just add a couple of comments. And so this afternoon we were on a call with the governor's office talking about business reopening, which is really critical to our county and to our state. We're currently in what they're considering a phase one of the business reopening plan. And as they determine it, it is a safe and phased approach to getting businesses going again. One thing that's interesting, I thought, from that was that Tennessee is in the top 5 states for being allowed to reopen. So because of the great work that the health providers that we hear from weekly have done in our region and others and across the state, Tennessee is in a really good place. So businesses are opening. The mall has opened. I think around 30 stores in there. I think the big one, well, Dick's Sporting Goods open. Belk's is open with entry only from the outside. And so restaurants, as you know, are opening. Close touch businesses, close contact businesses open. I think today with being able to go get a haircut, which probably going to be a high priority for a lot of people, at least those with hair, and include me. You may recall that the task force that we have set up to try to help local businesses open and do it in a safe manner continues to meet. And I'll just again thank Dr. Kursky and Kristen for their participation in those sessions. I mean, their input from the health side is incredibly invaluable. But the task force has come up with a plan that we are launching across the community for businesses, and it's a campaign that allows a business to identify themselves as a Tennessee Pledge compliant business. As you know, the governor put out this Tennessee Pledge, which outlines guidelines for business reopening, and we believe in a more safe manner than just haphazard. So we went to the Appalachian Highlands Economic Aid Directory. That's the Region Ahead group who's out there raising money for small business and doing other things, with leadership from local economic development, regional chambers, tourist bureaus, etc., are in a campaign to contact business to help them reopen. So this was a plan to allow these businesses to promote themselves as a safe place for people who want to shop or to eat or to dine in or to get a haircut, for example, identify themselves as a compliant with the pledge business, to enhance their business, and also to the community say this is a safe place to go. And so we have folks that are working with us. Dr. Dorner from ETSU has developed a mapping system. So if you go click onto this website and you look for the Tennessee Pledge, it'll take you to businesses that have identified themselves as being compliant with the pledge guidelines. And so we're going to, the mall, by the way, is, as a group, adopted this pledge. They've got their signs up currently, and we're going to have some sort of a press release tomorrow at the mall, acknowledging, trying to get the word out more across the community about how to access information. So anyway, that's what's going on. This on the governor's call, they talked about businesses reopening, and so as I just mentioned, close contact business open today. They still have large groups, and they mentioned large group venues and contact events, including youth sports, as still being on hold. This phase one, they're anticipating lasting maybe to the end of May, but certainly towards the end of May, until our health community can evaluate how the change in cases is taking place with these business reopenings in phase one. So churches, as you know, are not included in large group gatherings, but they are encouraged to continue to do drive-up worship services and online worship services, and to keep their groups below 10. So that is a recommendation only. That's sort of the business side of it. Locally in the county, Courts reopened on Monday. A little chaotic, but nevertheless, they're working hard to try to stay within guidelines, allowing no more than 10 people into the courtroom at a time, and no visitors, guests, no spectators. And so through Wednesday, it seems to be going a little smoother, and we're getting some of the cases that have been off the docket really for 6 weeks or so heard. So that's going on for the general county government. We're sort of beginning to move back into the workplace a little more in phases. The highway department, for example, has called most of their people back because they can work in a spread out environment. The historic courthouse, where a lot of the office space is still closed to walk-in traffic, as is the Johnson City extension of the trustee and the clerks. But they're still doing business, and we're still registering vehicles and renewing tags and issuing marriage licenses, and the trustee is registering deeds. So, not the trustee, sorry, the Register of Deeds is registering deeds. So all those things are still taking place. We're working on putting up personal protection equipment, screens at the windows, and that sort of thing for the potential reopening in perhaps the next few weeks. Still undetermined at this point. And I guess the last thing I would say on a good news side is that building permits, construction sites have been able to operate pretty much along through the way, are up in 2020 year over year from 2019, and had nearly a record month, maybe a record month in April, with 62 permits at a value of over $7.5 million. And compared to last year, with a permit value of under $3 million. So, that's helpful. It's employing people, and I think they're able to do that in a pretty safe environment. So I'll stop there and either answer questions or just turn it over to our chairman. Thank you, sir, for allowing us to provide this update.
Thank you, Mayor. We appreciate you, and thank you, everyone, for participating and giving of your time to answer our questions, and we do appreciate that. Mayor, can you tell us a little bit about what the governor said today about extending the meeting?
Right. Yeah, sure. His executive order, I believe it's 34. I think it was 34. It extended our ability to meet the way we're meeting electronically until June 30. So we have that ability, which we can continue doing these if that suits you, or at least we can continue to meet and function for county government.
Thank you. I appreciate you bringing us that update as well. Commissioner Jones, did you have a question?
Mayor Grandy, how does a business go about registering as one of the compliant practices and get a sign?
Very easy. You go to the Region Ahead website. That is Region. I think it's just regionahead.com is what I think it is.
Got it. Okay.
So, and there's a place on there. Just click on the Tennessee Promise. It'll bring you to a form. It's just a handful of questions, and when you put the business address in there, it will put a pin on your address to indicate by color what type of business you are, and by where the location is, where your business is.
And does the sign come with that, or do you have to do something special to get the sign?
Well, we just got these today, so we had these printed. Foster printed them. They're available in yard signs. This is about an 8.5 by 11 size, maybe a little smaller. This one is about 4 by 6. They'll stick on the windows. They're vinyl. They're easily peel off, so you won't ruin your glass or whatever. I just had a couple hundred of them printed myself, and we're going to have them at the mall for distribution and at other locations to be identified as we go forward.
What time is that at the mall tomorrow?
1 o'clock or 1:30. Susan, are you there?
I think the email's at 1:30.
1:30.
It's 1:30.
Okay.
I missed what that was. Would you repeat it?
We're just gonna have a press conference to launch this campaign officially and to get the word out that if you as a consumer, for example, want to find a restaurant that claims they're compliant with the Tennessee Pledge criteria, then you can go to this website and see what restaurants have signed up.
I just want to say, I think the signs are a great idea, and I've told the mayor this already, but it's great for customers to feel safe, but it's even better for businesses to be held accountable to that pledge. And I think there's a little bit more social pressure for businesses to hold up their end of the deal. If they have a sign up front saying that they're doing it, then customers will expect that. And since some of these rules are hard to enforce or maybe even impossible to enforce, I feel like the added, kind of expectation that the sign provides could really help carry some follow through here with businesses in the upcoming months. So I hope you can get lots of those signs made. I think they'll work for a while anyway. I think it's great.
Well, we just wanted something that was consistent and identifiable for businesses that claim they were working hard to be compliant with the guidelines in the Tennessee Pledge. I mean, our goal is to get business rejuvenated, but to do it in a manner that's safe and consistent. So, I mean, what we don't want to do is get businesses open and get people in a place where we have to go back to square one as far as shutting things down. So, that's the goal. That Kristen Mennick with the health department has worked with her environmental folks, the folks that inspect restaurants, and work with them. For example, they were agreed to take these with them when they go out to work with restaurants for reopening. And so we think that's another way we can get these spread around a little bit. We have really good people on this task force. We have business people, and we have a Board of Education representative on there. Our very own Gary McAllister has been instrumental in coming up with some great ideas, and he brought Ashley Grindstaff from the mall into the program for us, and they embraced it right away. So I think the thought from business is that they're going to use this as a motion to identify themselves as a safe place to be. As Commissioner Jones pointed out, we believe people who venture out want to be in a safe place. One of our task force members turned out to be a COVID positive case at some point in time, and this particular individual has a very strong feeling about wanting to go where he feels like he's going to be safe.
Mayor Grandy?
Yes, ma'am.
I just happened to talk to Andy Dietrich. I thought what he organized and the group he got together and his purpose of helping small businesses might be good to be reported to our commission updates if they continue.
Okay. Andy, I'm sure would be pleased to come on a call and answer for himself. The website that we are driving this Tennessee Pledge across is the same website that is supporting the project that Andy's doing that's raising money for small businesses that haven't been able to get help otherwise. So
right.
the good thing about this is it all is just sinking into one place. Okay. Well, anyway, Mr. Chairman, anything else for me, sir?
Well, thank you, Mayor. I do see our next item on the agenda is a report from Michelle Stewart, our HR and benefits coordinator, and also our COVID-19 coordinator update of current status of the county officials operating under the temporary policy adopted on April the 2nd. Michelle, do you have anything to bring to us about that?
Good evening, Chairman and Commissioners. I sent you an email yesterday just giving you a brief update of where we are from a personnel standpoint. As of today, we do have one person on emergency paid sick leave for testing. They tested yesterday. For the total of emergency paid sick leave, we've had 10 employees take advantage of that. 8 of those were testing and quarantined, and 2 of those were childcare. So the federal leave policy sure has been beneficial for those people. We have 26 employees that are still continuing to telework. We have 6 employees that are continuing to self-isolate. Those employees either meet an age requirement or the CDC guidelines for high risk. So those are self-isolation. The offices that have resumed normal hours are the Circuit Court went back May the 4th. The highway went back May the 4th. The property assessor went back May the 4th. Clerk and master went back May the 4th. Purchasing went back April 27th for regular hours. And then the election commission are moving back to regular hours on the 11th. As Mayor Grandy said, we are working really hard to make sure that we protect employees. Under his direction, Willie Shrewsbury ordered hand sanitizer, and I've been distributing that to the departments that need it, and to those field inspectors that have started going back in the field from the property assessor's office, and those in zoning that have been in the field. We're also taking precautions. Masks have been ordered. We are continuing temperature checks here at the building. The employees that have taken advantage of some time off under the policy are very appreciative to the commission for that opportunity for them to be at home during the outbreak seems to be the peak. But does anybody have any questions from me from a standpoint of employee practices or time off or anything like that?
Seeing none, thank you so much, Michelle.
Thanks.
If there's do we have any questions for the commissioners? For anyone? Do I have a motion to adjourn?
I have a question.
Oh,
Sorry.
Mr. Joe?
Sorry. When and how do we discuss the format for ongoing meetings, and if we continue electronically or we continue to meet weekly?
I think as far as electronically goes, I think trying to abide by the governor's order, I think it's really going to be hard to try to put that together right now under the current phase that we're in, with all of us trying to meet in the staff. So I guess I'll kind of wait for some direction from the commission too as well. If you want to continue on with Wednesday meetings or Wednesday updates or every 2 weeks, with 15 of us trying to meet in a room with the staff, I mean, you're probably looking at close to 25 people.
Right. Actually, the governor's order is still in fairly close quarters, 10 or less.
Right. So I would assume that our regular meetings will continue electronically until something changes with the governor's orders. or a different, we move into a different phase anyway.
So through June 30th, and then will we have this meeting again next Wednesday?
I think that's up to the commission. If you all feel that it's beneficial to meet every Wednesday, or we could try to meet twice a month. I feel like if you all have received benefit from it, it's something we should continue to do, or at this point in time, I guess I kind of wait for a recommendation as well a little bit.
Mr. Chairman, next week would be the 13th, and then following that, my regular meeting is on the 18th, if I have that correct.
Right, that's correct.
So it's a little bit early, and the last time we had a Monday meeting, we did not follow it with another meeting on Wednesday, but so that's just sort of looking at if you wanted one next week, and then maybe skip the 20th and or the 27th possibly. That's just a thought.
I think that seems reasonable.
Is there so do the one next Wednesday? Is that correct?
Well, it's commission's pleasure. We'll do one when you want to, but there was next week, and then after that, really just in 5 days, you have another one on the 18th anyway. We can either provide an update then if there's anything hot going on.
Okay. Commissioner Wheeler?
On the issue of electronic meetings, the governor's order that came out today goes through June 30th, and we, of course, have to deal with the budget. I don't know about other public hearings, so I've really got two questions. One, have we been putting off anything else like rezonings or anything so far that would have required a public hearing? Because obviously we don't have a way to do that, I assume, right now. And secondly, we are going to have to figure out how we're going to do a public hearing on the budget unless something changes on that. State, right now the state's not giving us any leeway that I'm aware of on that. So we're either going to have to figure out how to do a public hearing on some platform like this or have an in-person meeting.
Yeah, I'd be happy to contact the governor's office and see if they have considered any guidelines for public hearings. That's a great question, actually. And just sort of see what they say before we just move in some direction. Would that be something you'd like me to do?
I think that's a good idea, but I also think we need to be aware if I know, for instance, with Jonesboro, they've not had anything to call for a public hearing, but we know one's coming down the pipeline, and I assume the county may have the same type of things with zoning.
I had a call today from somebody.
I'm just wondering if we really need a meeting next Wednesday unless something has drastically changed, because we've been very much updated by the health officials and emergency management. What do you all think?
I tend
so
to agree
far, I feel like
on that aspect, as far as if we don't have any drastic changes within the next week, I don't see actually needing a meeting. That would be my recommendation.
And I'm fine with whatever you all want to do, but I do feel like it seems like every week there's something new. Like this week, some of the information about businesses opening was new. So, I mean, maybe the meetings get shorter and shorter, but I've still found good information is coming from these weekly meetings. And so for me, at least, I'm good with continuing, but whatever you all feel like would be helpful.
I think getting the numbers straight from our health provider folks that have helped us out so much is helpful in talking with people in the community. when they're asking questions, being able to address those and knowing that we have good, solid numbers from here, that has been particularly helpful to me.
I would agree too. It's been very helpful to me, even though I'm on this. I'm like all of you. I've been in a lot of meetings and on the task force with the mayor, and I hear a lot of this information twice. But sometimes I'll miss something. That's good to get it back out. And just like the businesses, we've been trying to get information. We've been trying to get that more out. And Commissioner Jones, you made a comment tonight about it. We got it out to you, so I think it's been very helpful to continue doing this.
Well, I must have said something Commissioner Wheeler didn't like.
What to me?
I fell out there for quite some time.
I promise I didn't delete you.
Well, listen, I certainly don't mind giving my Wednesday evenings to getting more information. Please know that.
To Commissioner Wheeler's question, if I may, this office is working with the planning director to ensure that anything that's required for public hearing or would have a deadline that would automatically trigger some event, that's being considered. And we have a running list of anything that was pending in March that did not go on to the April-May meeting. And I'm happy to share that with the commission if that would be helpful for y'all to have an understanding of any of that business.
So would we just like to meet again at our regular meeting and kind of think how that looks? Or
while you were out, Chairman, there were a few of us voicing that we were continuing to get good information from these weekly meetings. So yes. I think our thinking is to go ahead with one more Wednesday meeting. Then the following week is our regular commission meeting on Monday. And then we can kind of reassess after that, I think.
Absolutely. That's fine with me.
And by all means, if like Mr. Sells or any of our other health experts or people are, don't have any updates for us, just bring in who we need and we can make the meeting super short if there's nothing much to talk about.
Okay. Well, me and the mayor will try to work hard every week to get it together. I know he does for sure.
We really appreciate that. I really can't tell you how much, I said it earlier, but I can't tell you how much this helps. I appreciate the work that you and the mayor put into this.
Well, he stays on top of it, that's for sure. All right, is there any more questions or discussion? I'll entertain a motion to adjourn.
So moved.
I'll second.
Commissioner Wheeler, seconded by Commissioner Jones to adjourn. Madam Clerk, if you'll call the roll to adjourn, please.
Mike?
Yes.
Harris? Fitzgerald?
Yes.
Edens?
Yes.
Davenport? Matterly?
Yes.
England?
Yes.
Malone?
Yes.
Williams?
Yes.
Carriger? Jones?
Yes.
Hester?
Yes.
McAllister?
Yes.
Wheeler?
Yes.
Ford? 11 yes, 4 absent.
All right. Thank you, Madam Clerk. We stand adjourned.
Thank you very much.
Everybody. Thank you.